The floor is yours, Doctor.
Oh, thank you very much, Yazan. Thank you, Mohammed. Thank you, Abdullah Aziz. Thank you to all of you who have taken time out of your relaxing schedule. I can't say busy schedule because it's end of the academic year and they should all be having fun. Um, well, I would like to start by saying that I appreciate and I applaud the legacy leavers because what they have put together tonight is an amazing session. I have gone through the session with Abdulaziz already, so I have an idea of what is going to be presented tonight. But without taking too much of your time, let me take you through quickly 2 slides, which will give you an idea of where we are as a college when it comes to performance in IFOM basic science examination. So, in a nutshell, the first batch took the IFOM exam about 3, 4 years ago. And at that time, the pass rate was 53%. We like to applaud and acknowledge the first batch because they had very little guidance, very little guidance. They prepared by themselves and they were able to, at least half of the class passed at the first attempt. But the second batch, maybe they thought it was an easy exam, so they didn't take it seriously. So the pass rate was 40%. And then came the third batch, and they, of course, improved, and it was around 60% pass rate. But what we noticed with the current year 4 students, our legacy leavers, the Yazan et al., is that the first attempt was actually quite brilliant, 66%. So they have set the standard so high for you guys tonight, and you will have to, inshallah, beat this record. But when it comes to the second attempt, the first batch, well, because a number of them had already passed, so they didn't take it too seriously. So 50% of the class passed again of those who sat for the exam. But for the second batch, they realized that their performance in the first attempt wasn't great enough. So they put in more effort and 64% passed. The third batch, because about 60% passed the first attempt, the majority of those who did well in the first attempt did not show up for the second attempt. We've passed 50%, halas, so why do we have to come back for the second attempt? That resulted in the pass rate dropping to 53 from 59%. But Abdulaziz Mohammed Basant et al., they never give up. They never give up. It's an incredible set. So from 66%, they still came back forcefully in the second attempt, and the percentage pass rate went to 69%. Incredible set. The first batch, when we combined the first and the second attempts, the pass rate was 76%, and we were pleased with them because being the first batch with the little guidance they received, they were able to pull their weight and they did well. The second batch, of course, when we combined the two attempts, the pass rate was 63%. The third batch was 72%. And of course, nobody will doubt the performance of the current legacy leavers. They are going to leave a legacy that you guys will have to summon a lot of courage to break. 86%. But let me quickly add that they came to me and asked for a third attempt. I'm like, guys, you've already done so well. Why do you need a third attempt? They said, it's our right. We need a third attempt. I said, it's okay. I have not shown you the result of the third attempt. It's just, it's incredible. I think only 3 of the 71 students in the class to pass. Amazing. But one thing from this slide is that since the first batch took the IFOM exam about 3, 4 years ago, we have consistently outperformed international comparison group. As you can see, the first batch had almost the same score as the international comparison group, just almost the same. But from the second batch and onwards, and you can actually see the gap is getting wider. So as a college, we are doing extremely well. And there are a number of factors that can be attributed to this performance. One of them is the institution of the comprehensive exam. A number of students hate the idea. They fought against it, but the college stood firm that we're going to prepare you for IFOM. We want you to outperform international comparison group. And then, of course, with the support of the college, with regards to the provision of UWorld subscription, which from next year, inshallah, will be full subscription. Currently, we're giving half our subscription for BSE and the clinical science examination, but the college will be responsible for full subscription from next year, inshallah. So I would like to use this opportunity again to thank the legacy leaders. I cannot thank you enough because what we are going to do tonight is remarkable. You have dedicated a lot of time and energy. You've put in a lot of efforts to prepare this presentation, to prepare for this session, to share your experience, your knowledge, to share a number of resources that you have acquired over the past year or two. You have not only done very well, but you want your junior colleagues to do extremely well. The college is proud of you. I am proud of you as the associate dean. And I can only say to you, Jazakumullah khairan. We are so happy. We are so proud of you because you are not selfish. Because others will say, since we have done well, why do we have to bother about the others? But no, you are saying we have done well and we want others to do much better. And that is the whole reason for this session tonight. And I wish every participant in this session a wonderful evening. And once again, my prayer to you is may Allah reward you most abundantly. And for you who will be listening to this session tonight, they request from you only two things, prayer from you that Allah reward them. And the second thing is, if you do extremely well, if you outperform them, share your success with them. That's all they ask of you. Once again, thank you very much, and I wish you all a wonderful evening. Assalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallah khair, Dr. Mubarak. Thank you so much for being here today at this late time. We're really appreciative, and just like you mentioned, inshallah, we're very optimistic that the upcoming batches will definitely beat our scores, starting from the next batch, and of course, batch 2026, some of them are with us already on board. Inshallah, guys, next year, this time, you'll be presenting a better presentation for the upcoming ones on how you actually managed to beat our scores. I'd like to apologize for the connection issue. I just hope it doesn't happen again. So without further ado, let's proceed with the presentation. So the outline, of course, started with the...
Yeah, Muhammad.
Yes, doctor.
Yeah, Muhammad, if you can, please excuse me. I wish you all a pleasant evening. I'm an old man. I have to go to bed early to wake up for Fajr. Assalamu alaikum wa rahmatullahi.
Thank you so much. Thank you.
Assalam.
Okay, so back to the presentation, guys. We started the opening remarks from Dr. Mubarak, as you saw. We'll then go through a few question marks related to the basics related to the IFOM. After the question marks, my colleague Besant will proceed to talk about the examination day. Then Abdulaziz will talk about the preparations for the IFOM, scheduling, and a final message to both batches for the better preparation of the IFOM. So let's start with the question marks. And of course, the first question we need to ask is, what is the IFOM BSE? The IFOM BSE stands for the International Foundations of Medicine Basic Sciences Examination, which is a comprehensive assessment tool that is prepared by the NBME to test the preclinical knowledge in medical students worldwide. The NBME is the National Board of Medical Examinations, and for those who do not know, they are the same board who prepare the USMLE examination. One may wonder, how important is the IFOM, or does it actually matter? The answer is a big yes. for two main reasons. The first one, of course, is that passing the IFOM is a requirement for you to progress through the clerkship phase in CMED. The second reason, of course, is that the high achievement is going to be looking good in your CV for future applications to the hospital, inshallah. So what are the things that you need to know about the IFOM? These are the ABCs, the things that you need to know. The first thing is the number of attempts that you have for the IFOM Basic Sciences examination. The college provides you with 3 fully paid attempts at different timings, which we'll be discussing in a bit. And you also have the opportunity to sign up for individual examinations. Yet I need to speak a little bit about this in a bit and the process of applying for this. And just a general note, if you have any questions, please leave them in the chat box. If I read them throughout the presentation, I'll answer. Otherwise, we'll leave them to the end of the presentation. The IFOM examination, sometimes you'll hear a formative IFOM, other times you may hear a summative IFOM. The difference is basic, very simple. The first attempt you'll be having for the IFOM is considered the formative trial. It is mainly because you still have not finished the basic sciences. You still have 2 units to take. Therefore, the first trial, some of the previous students were not very encouraging for us to go for it. However, we strongly encourage you to take this attempt for one reason. Passing the formative examination or the formative IFOM is sufficient for you to progress through the clerkship phase. The rest of the trials, the second and the third, and the individual trials that you may electively choose to sign up for are also considered the summative IFOM examination. As for the timings for the IFOM, it's the same every year. Basically, you'll have the first attempt before finishing the basic sciences, which is the summer of year 3, batch 2025. Inshallah, you'll be having it at the end of the summer or the beginning of the next semester. The second attempt, you'll have it in winter. Basically, you'll be having it after you finish neuroscience and the multi-system unit before progressing to the introduction to the clerkship semester. While the third attempt is going to be the summer of year 4, which is the last attempt that you have from the college for you to be able to proceed to year 5. As for the additional timings, I cannot emphasize enough that you need to prepare this early and you need to make sure that you plan it with the college in case you decide to sign up for it alone. You cannot contact the IFOM directly, and even if you do so, they'll ask you to contact them officially through the college. So usually students decide to go for an additional attempt for the IFOM, sometimes for 2, in case they fail to pass the second attempt of IFOM. It's quite too early for you now to aim for registering for an additional IFOM trial, as you have not had the first attempt. However, in case you choose to do so in the future, please contact Dr. Mubarak and do that early so that you do not have any problems with the registration. So when to do the IFOM, let's take a look at a simple concept map that shows you the process. You'll be having the first attempt, like I said, in August of 2022 for batch 2025. After you take the first attempt, you'll progress through the fall semester. There is a good chance that you may have it even after the start of the semester. We had it the first week after we started our fall semester of year 4. Throughout the fall semester, to be honest, you'll not have so much time to revise anything from the previous years, the 3 years of medicine. This is mainly because you'll be overwhelmed preparing for the MSR presentations as well as studying for both units 11 and 12. However, after you finish these units, inshallah, 1 month into the holiday or the mid-semester break, inshallah, you'll be having the second attempt. Usually it happens at the January or the beginnings of the following year. In your case, inshallah, you'll be having it in January of 2023. After you finish the second attempt, an important note to make, even if you fail the first 2 attempts of the IFOM, you'll be proceeding to the next semester, which is the introduction to the clerkship phase. You'll be placed in Hazm Barik, Al Khor or Al Wakra hospital by then, inshallah, and that's where you'll be starting your clerkship phase, and all your preparations are actually going to be deviated towards the clinical phase, where things are going to be going slightly different. So do your best to try to pass the IFOM from the first 2 attempts. So after the spring semester, had you not have passed the IFOM yet, or if you're trying to improve your score, you'll be having a third attempt.
I think we lost Mohammed, so let's give him a few seconds. He might reconnect. Everything should be fine, just for the connection issue, okay?
Okay, guys, can you hear me?
Yes, Muhammad, we can.
I'm sorry for the connection issue. Where did I stop? Where did it disconnect? Okay, so
you were speaking about the third
again,
attempt.
Yeah, in case you fail to pass the third attempt, you'll be quite tight in terms of time. You'll have to register individually for another attempt. Conditional that you pass the IFOM in one of your trials before the beginning of the fall semester of year 5, you'll be allowed to proceed throughout year 5. Had you have failed the 3 attempts of the IFOM, unfortunately, you'll be mandated to repeat year 4 until you pass the IFOM successfully. So the important question that's wandering around your minds, what does the IFOM Basic Sciences examination consist of? A general overview, and then Abdulaziz, inshallah, will be taking you throughout the details. This is the table you'll find showing you the details of the IFOM. A general note on this table, the percentages are going to be changing from these percentages that you see on the screen to different ones in the clinical sciences examination. So just as an example, as you can see here, most of the examination is going to be covering the foundational science concepts and the medical knowledge. Around a third of the examination is going to be around about the diagnosis, and slightly below 10% is going to be about the management. Once you go to the clerkship phase and the clinical sciences examination of the IFOM, inshallah, most of the examination is going to be related to the management of patients, with a huge bulk also on the diagnosis. There is a small percentage on communication, interpersonal skills, and professionalism, as well as practice-based learning. However, you should not ignore this, because you'll be seeing patients in the hospital, inshallah, soon. And when you see them, by then, your professional behavior, as well as your ability to communicate with patients, will significantly depend on your preparations for that phase. The detailed schedule can be seen in this slide. Before going into the big detailed schedule, please take a look at the lower part. As you can see, most of the examination is going to be about the abnormal findings instead of the normal ones. So most of the examination is going to be about pathology, microbiology, diagnosis, slightly about the management. However, most of the cases are going to have abnormal findings that you need to identify in the examination. As for the bigger table or the bigger picture here, you can see that the table identifies each system separately and tells you what is the percentage for each system. The bulk of the examination is going to be on 2 main systems: neuroscience, which you still have not covered yet. Inshallah, you'll have by the second attempt. And of course, the cardiovascular system, which you have already taken up to 13%. And trust me, takes a huge bulk of the examination. The rest of systems range from around 5 to 9%. Excluding immunology and hematology, which take a lesser contribution up to 5%. And of course, biochemistry, genetics, basic pharmacology, and a few other disciplines as well are considered under the topic of general principles of foundational science, and they add up to 14%. As for what systems to choose to study first, how to go with the study plan, inshallah, they'll be explained later in this presentation. So after you have your IFOM attempt, what happens is that you're going to be receiving the result score, as you can see. This is the sheet that details your scores on the systems as well as the disciplines. It has a lower performance scale over here and the higher performance with the average performance. Each bar represents your score, where you actually lied in terms of the performance compared to everyone else who took the examination. At the top of the image here, you can see that you have the total test equated percent correct score, which is basically your final score out of 100. The passing grade from the college is 50%. It used to be 60%. However, by now, it's considered to be 50%. An important note to make here for the high achievers: there is an international standard pass that is set by the NBME, which usually ranges between 75 to 80%. To my knowledge, for our batch, it was at 76%. In case you get this percentage, you're considered as an international pass, and I'll talk about the certification for this in a bit. So where are you going to be doing the IFOM? Simply, you'll be receiving an email with the registration details sent to you by the QU Testing Center. Everything is planned by the college. You have no preparations to make from this perspective. As you can see, this is just an example on the email we received. It gives you basic instructions that you basically need to get with you an ID card or a passport. Times of COVID, you need to present with the ihtiraz application, and the rest of the details, you can read them in the email. The examination will take place in Qatar University. The place, however, differs. We once had it done in the D01 building. Another time, like the one mentioned here, we had it at the A06. A general note, the take-home message out of this slide, you have to be there on time. The QU Testing Center are very delicate, they're very disciplined, and you need to be sure that you meet everything they ask you to do before coming to the examination center. So what happens after you take the IFOM? Usually within a week time, maximum of 2 weeks, you'll be receiving an email from the college telling you, giving you an update about your score. The email, at least for most of the students, is like the one shown on the left. Congratulations on passing the IFOM. The email sent by the college does not give you any specifications in terms of the grade, just that you scored above 50%. And you'll also receive your own report showing you what you have done in the first examination. It gives you a good idea on what you need to improve on for the second attempt if you choose to do it as well. In case you get the international standard pass set by the NBME, you'll be received a certification. Guys, I'm sorry, you still can hear me, صح?
Yes, we do, Muhammad.
Okay, you'll receive an acknowledgement certificate by the NBME certifying you in the basic sciences examination. This is a good boost for your CV. In case you do not get it in the first attempt, we actually encourage you to do it again. A general note in this regard, if you pass the first attempt, you try to get the certificate in the second one and you fail it, you're still considered a pass for the college. So these are the general remarks. What comes next? Basically, you'll finish the attempts, you'll move on to year 5. However, there is one important thing you need to keep in mind. Throughout this period, we highly encourage you to do the USMLE examination, the United States Medical Licensing Examination. It's not a requirement by Hamad nor by the college. However, this is going to be the best time for you to do this examination. As you move on to the clerkship phase, it's going to be quite complicated for you to cover the basic sciences topics again. The issue with the examination is it's quite costly, reaching around 5,000 riyals to register for a single trial. We will not go to the details of the USMLE. In case you want details in regards to the registration, the requirements, and the preparation, we can provide it to you for in a different session if you choose to do so. And once you pass the IFOM Basic Sciences examination, hopefully by the second attempt, because you'll be starting the clerkship phase in the spring semester, you will start your preparations for the IFOM Clinical Sciences examination, which is quite different from the Basic Sciences. So the take-home message out of this is that throughout the whole period, you're encouraged to do the USMLE Step 1, but you also have the option to have additional IFOM Basic Sciences examination trials if you choose to do so. Once you finish all of this, you'll start your preparations for the IFOM Clinical Sciences examination. I've seen a few questions going through the chat. I think they will be answered at the end of the session. This ends my part. I leave you with Basant. She'll take you through the examination day. Basant.
Okay, good evening, everyone. Can you hear me?
Yes, we do, Basant.
Okay. Okay, just 1 second.
Okay. Give me a second, Basant, please. Okay, Basant, you can go.
Okay. So good evening, everyone. My name is Basant Sayed, and I'm gonna take you through what you're expecting in your exam day. And we will go through some questions to familiarize yourself with the style of the IFOM questions and give you some tips and tricks of how to approach an IFOM question. So to start with, the duration of the exam is 4.5 hours, and it's divided for first 15 minutes tutorial, in which you will get to know how the exam looks like, what features in the IFOM, and like highlights and all of this, and you will get an example of a question that you will solve, how to choose the answer, and all those technical issues. Then you will start with the questions, which is basically a 160 questions. It's not moving, Muhammad. Okay, which is 160 questions split into 2 blocks, and each block is an 80 question. So 15 minutes tutorial in the beginning, first block, which is 80 questions, then you get 15 minutes break, and then you get the second block, which is another 80 question. Okay, I guess there's just 1 second.
Basant, can you try sharing from your side if it's lagging when you do this?
Okay, so 1 second. Okay, can you see the slides?
Yes, we can.
Okay. Okay, so sorry for this technical issue. So again, I was saying that it's 4.5 hours the duration of the exams. You will have the first 15 minutes for tutorial. You will start with the questions, which are 160 questions. They are basically 2 blocks. So the questions are divided into first block, which is 80 questions for 2 hours. And then you will get a 15-minute break. And then you will come back to do the second block, which is another 80 questions in 2 hours. At the end, you have like a survey, which is optional for you to do. But it will not, like, it's not part of your timing. So when you calculate the rough time for each question, it will be around 90 seconds or 1.5 minutes for the question. And it's important to know that each block is a block by itself. So the time the time that you do in the block will stay in this block. For example, if you finish the block early, those extra time will not be added to your break, will not be added to your second block. So 120 minutes for the first block, you submit, you will go for the break, and then you come back to start the second block. So it's a computer based, and you do it on test center in QU. Mostly it's Al-Bada building. So you will not need your computers. It's like the computers are there in the test center. And as I said, when you finish a block, you cannot go back to it. So when you have your 120 minutes for your block, you need to use it for the questions, for the 80 questions. Because if you submit early, those extra minutes will not give you any benefit in your break and will not give you any benefit in your second block. And how the scenario looks like is that you will start the tutorial, which you can skip, but again, it will not give you any extra minutes of the tutorial. And then you will start the first block. Then you submit whenever it's 120 minutes or before. Whenever you submit, the computer will automatically start to calculate for you the 15 minutes. So this is some kind of personalized exam. So you may finish like few minutes earlier than your colleague. So you go to your break before him or before her. And then automatically when the computer finish counting the 15 minutes, it will start the second block immediately. So you need to be there on your computer before the 15 minutes finish, or the second one will start counting on you for the second block. So to emphasize this point, any extra time you finish in the block will not be added to the second block. Now, when we talk about the exam itself or the questions, it's important to familiarize you with the questions themselves, because the most asked questions is the IFOM questions, easy questions or not. So to answer this question, I will compare the IFOM question to both the college exam and the USMLE questions or UWorld questions specifically, the one that you solve in UWorld or the one that you solve in Ports and Beyond sometimes, or those extra resources. So to start with the college exam, we are lucky that in CMID, when we get a question, we get standardized type of a questions, which is you start with a scenario and there's a long scenario, complete scenario, Mr. X 22 years old gentleman presented with X, Y, and Z. And finally, you will have the question, the direct question with the question mark and the choices. Could be 4, 5, 6, 7, whatever, depending on the question. It's similar in IFOM. So you get the same idea. You have a scenario and you have a question at the end. And so don't expect that you just have a direct question, what is the nerve that supplies the lateral part of your shoulder? You will not get this either in the college exam or in the IFOM exam. But you will get the exact same question with the exact same answer in the IFOM, but in another way, describing a person who was hurt on his shoulder, or who was involved in a trauma. And then he would like you to know what this nerve affected. So you're lucky because you're already familiarized to this type of questions in the college. Now, when we compare the IFOM question to the USMLE questions, or sorry, for the UWorld questions, the main feature, like the difference between both, is that UWorld questions are longer than the IFOM question. This feature has both pros and cons. So starting by the pros, in the IFOM exam, you will have shorter question, like 3 sentences, sometimes 2 sentences to 4 sentences. And this will give you, like, you don't need to spend a lot of time to read the question because it's short. So this will give you better utilization of your time. But the bad thing is that you may not have the whole information in this short question. So let me put in an example. If the question is asking about certain type of bacteria, for example, a microorganism, on a UWorld question, they will give you different features of the bacteria in order to identify it, like the gram stain, special tests like coagulase negative or positive, oxidase positive or negative. They will describe to you the disease that this organism caused, certain features of it, and certain epidemiology of it. In IFOM questions, asking for the same exact pathogen or like microbe, they will give you only 2 features or 3 features. So less features, but for the same thing. The good thing is that, again, if you don't know, if you just know those main important features, you will get the question right. But if you need like more features or more details about the certain organism to identify it, then it will be a little bit hard. So this is the only difference between IFOM questions and USMLE questions or UWorld questions. Solving UWorld questions, therefore, will make you prepare better for the IFOM questions. So because you will get a full idea of the question, full idea of the aspect of a disease or diagnosis or drug or whatever the question is asking about. Therefore, when you find in the IFOM, from a glance, you can immediately solve the question. So important point also, like to you, if you cannot answer a question within the time that you put yourself, which is around 90 seconds, mark it and skip to the next one. But importantly, from a personal point of view, it's very, very important that you don't leave that question without an answer. In other words, if it's an easy question and you know the correct answer, just answer it and go for the next question. We want you to do this. If it's a question that you are, I don't know, is it B or C, between them, choose the one that you think is the most likely the answer, mark it, and go to the next one. If it's a difficult question that you completely know nothing about and you just clueless about the question, answer the questions, like choose any C, B, whatever, choose the answer that you feel it is the answer or like based on your guess, and mark it and go to the next question, because you don't know, maybe if you reach to the end of the exam, you don't have time to go back to your flagged question or your marked questions. So by the time you finish the block, you already have an answer for every and each question. So that's a very, very important. Okay, go with yes. And if you don't know this question, choose C, mark the question, and then go back to the question at the end of your exam. But never leave a question unanswered in the time you read the question. not in general, okay? And in general, of course, don't leave it unanswered because you will not lose marks for getting a wrong answers, but you will have a good chance, 20%, 25% of getting the answer correct if you just choose random, okay? Okay, now let's go through some questions to familiarize ourselves with the style of the IFOM questions, and at the same time, we get some tips and tricks of how to. So the questions that will be presented are, you can find them in the NBME IFOM sample questions. We can share with you the link. So let's question, and again, the first tip, the most important tip I would like you to learn is that you go immediately for the question and take it, which is, which of the following best describes the results of the CT scan? So as you can see, by only reading the question, I can solve it because it asks directly about the results of a radiograph or of a biopsy of a sample of whatever. So I can go immediately to the CT scan, read the CT scan, and choose the answers. So based on the CT scan, like from the first look, you can see that the liver is on the left, so it's vice versa. So you can immediately say, and the heart on the left side, which is normal, so you can immediately say that this is situs inversus, and it's a very common like diagnosis you can get in your exam. So immediately I solve the questions and I choose abdominal situs inversus, which is the correct answer. So as you can see, I read the question, I analyze it in my mind, I read the radiograph, and I choose the correct answer. I got the mark in like 20 seconds or less. The rest of the time, like from 20 seconds to the 90 seconds I put to the questions, I can use them in another hard question. I can use them to recheck my answer here to make sure, like, okay, it's not ruptured spleen, it's here and it's good. It's not ischemia, the spleen is here. It's not exocardia, for example, and X, Y, and Z. So that's why I'm telling you, read the question. It will give you more time. It will direct you to the answer, and you can immediately answer like from the question only. And this will like make us go to the second questions, which is, if the question itself is not enough to read or to find the correct answer, what should I do? So let's go to the question and read it. This neoplasm is most likely derived from which of the following cell types? So I got an idea in my mind. Now this is in few seconds. I got an idea that, okay, it's asking for certain neoplasms, what type of cells. So I may expecting some hormones or some like thing with this neoplasm producing. So I can get this cell type. So now I can go and skim through the question. Okay, it's variant, okay, mass in the neck, okay, something in the thyroid, TCH forms or reference, okay, normal. What's the abnormal? Serum calcitonin is increased. The mass is polygonal spindle, okay. Okay, what's okay? Just I read serum calcitonin is increased. What comes to my mind? It is parafollicular extent, so it's parafollicular C cells. I don't even need to read the rest of the thing. But when I've read the rest of the sentence, okay, like it's solidified in my mind that the diagnosis is a medullary thyroid carcinoma from the C cells. So see, 4 sentences of the question, you can only use only 2 to 4 words to get an answer. So that's why don't overwhelm yourself with the number of the sentences or of the how the question, how big is the question. Just focus on this small detail that will immediately tell you what's the answer. Okay, so coming to another example, which is very, very important, not only for IFOM, but for CMED exams, because this type of question, I found that many students found it a form of nightmare for them because they get lost and they don't know how exactly to choose the answer, despite that they may like 100% know the concepts of the question. So let me give you a trick to solve this type of questions. Whenever you see questions with different like I mean columns and high, low, and those kind of things, you will immediately know that this is a change question. So there is a certain stimulus, certain thing, certain like extra thing, which will cause a change to a certain variable. And you need to identify those like variables. So you don't even need to read the question in this form of questions, like I mean the short question at the end, because it will definitely tell you what's the changes that will happen. You can go to the question and find what the stimulus that happened to identify the changes. So through reading the questions, skimming through, and what I'm doing now with you, like skimming the questions, is what I really do in my real life. Okay, so I really read the questions like this. Okay, 45. So increase the potassium intake. Okay, there's potassium carbonate and increases the serum potassium concentration. So I identified the stimulus, which is the high potassium in the blood. So I need now to know what are the changes that happen for this lady who started to take calcium in her diet. So the important trick here is you start with the column that you are 100% sure of. So let's start, for example, by aldosterone, because I know that most of you know the rule of aldosterone. You even know it from biology in secondary schools. So we know that aldosterone is responsible for sodium reabsorption and potassium secretion. So definitely in a person with high potassium in their blood, they need to get rid of it. Aldosterone will be very high. So just based on the small basic information I know, I just excluded many of the answers and I only left with those two, where both of them states that aldosterone is high. Now, when you look to the other two columns, you will now find that like the variable potassium excretion is already set. Both answers are high. So you look for the limiting limiting variable, which is the potassium secretion, and will immediately think that, okay, I need to excrete this extra potassium, I need to secrete them. So this will also definitely be high in this lady, and you will back the answer easily. So you can use this way in all your exams, especially CMED exams, because they get this type of questions a lot. GI, kidney, renal, and all of this. And also in IFOM exams, because this will help you save time and will help you pick the correct answer. Okay, so I think this is the last example we have. And by this, I would like to show you that you don't need to know every single detail in life, in medicine, in order to pass the exam and in order to get a high grade in the exam, okay? By just knowing principles, basic principles, by just analyzing them in your mind, you can get the correct answer easily. So I get this question on purpose because I don't know what is the exact diagnosis, but I will solve it to you and show you how simple concepts may help you solve the question. So if you look at the question, it says this child's malnutrition is due to deficiency of what? Now, when there is a malnutrition and deficiency, you need to look at the symptoms because each deficiency causes certain types of symptoms. So let's skim through the question. Child with stunt growth, atrophy of muscles, and generalized edema of face, arms, and legs. And there is some histology here. But just from the symptoms, which is muscles atrophy and edema of the generalized edema, like you can easily know from basic principles that this is definitely a protein. Excellent. So this is protein. When there's no protein, there is no colloid pressure and all of those like basics HSF1 things that we learn. So this is definitely a protein. Truly, I'm saying to you that I'm clueless what this histology slide from the liver is about. I don't know the diagnosis, but I got the question right. And this is an important technique, an important concept I would like you to learn, is that don't overwhelm yourself. Don't freak out when you see biopsies, different pictures, different histology slides. Just go with the basic principles, and I guarantee that you will get the answers correct, inshallah. So finally, to finalize my part, in addition to the question solving tips that we went through during solving the questions, I just would like to tell you that don't freak out. You can do it and you can solve the question. Don't get distracted by the number of lines, by the pictures on the side. Just focus on your technique. Just focus on how to solve or approach a question, and then the knowledge will come by itself. And make a wise guess. Don't choose things which are contradicting to each others. Don't choose things which are similar. If you have, for example, side effects of certain drugs, and you know that this and this or similar things happen when, for example, BNS is activated, don't choose either of those. Choose other things. Exclude those things. And never leave a question without an answer. As I told you, when you open a question in front of you, read it, solve it. Whatever yani, this answer is the correct one, this is your guess, this is just a random C from Yazan, just do it, solve it, flag it, and move to the second one. Don't leave empty questions. Yeah, HSF 1 and 2 may really help. Sometimes you will use basic principles you learn through even biology in your secondary schools and solving questions in IFOM, especially for the units that you like for the neuroscience and multi-system units questions. And this is kind of a trick or a trick for those kind of questions when they are asking you about the mechanism of action of a drug. And I found it very helpful in like many times, because when you think of the pathophysiology of the disease itself, it may help you to get the answer. Even if you don't know what's this domanobenzil drug is doing, for example, just know the disease. What does this disease have in the pathophysiology? What's increase? What is decrease? What I'm aiming to increase or decrease? And based on this, you can pick up the mechanism of action of drug. One last thing before we go to break. Like apart from the facts about the duration of the exam, which is 4 hours and so, I would like to tell you that you will get bored in the exam, okay? And this is actually one of the facts from our personal experience. The exam is too long, like 4 hours, it's too long. 2 hours for a block, it's too long, yani, duration. So you may get bored, and I'm telling this to you not to freak you out or not like to be pessimistic, but just to inform you that this is normal. I'm normalizing it, okay? And when you get bored, try to like close your eyes for a few seconds, distract yourself from the exam itself, and maybe think of something else. Maybe just close your eyes and give yourself a few seconds break. Like change your position. This is always helpful. Like instead of lying down, sit still. But try to overcome this point of boredom, okay? I know that what makes worse is that we don't have even water in your room, but changing the position maybe your only relief or only something that to get over your boredom. And also quick solving is another trick to get over the boredom. When you feel that you خلاص فقدت الشغف, as we say between us, try to solve think quickly, like okay, this is a 25 and do like pointing with your fingers. This is always helpful, like it will wake up your mind. Do like this, okay, okay, and choose the answer and go, like question by questions. Try to answer fastly so you don't get this yani boredom for a long time. But I'm just saying it because it will happen to you in the 2 hours duration. Okay, I guess by this I have give you most of the tips and tricks we had from our experience, and most of the challenges we had also. So I guess that's the end of my part. No, Aziz, you'd like to go for a break now?
Thank you so much, Basant. It's very fruitful talk. Because we think we took quite long, so we'll be giving you about 2 to 3 minutes break if you wish to walk a little or have a coffee. And yeah, scheduling and the resources you'll be studying from is next, so make sure you don't miss out. Okay, so I think the break is over. Can I have someone confirm that you can hear me?
Yes, we can hear you, Aziz.
Okay,
And
that's great.
the link.
Okay. Okay, yeah. Our colleagues from the team are reading through your questions in the chat, and in any second they'll share a link in the chat box. It has a Word document that has all your questions answered right away. Okay. The link will be sent in the chat. Okay, so for the next part, we'll talk about the resources that you can use to study for the IFOM exam. These resources are for all the standardized exams, so they work well for USMLE as well, and they work well for your college as well, with the exception that the college exams are generally more detailed, so you'll be studying your own references in addition, like the books and these things when you talk about the college, okay? So the way we look at the resources are those that are essential, and these are 6. The first is UWorld. UWorld is the question bank program. For step 1, it has about 3,600 questions. It's actually very difficult to finish all of these questions. The more you do, the better, and we'll talk more about UWorld as we go along, okay? The second is First Aid Series, which is an annual book. There is a version of 2022. This book is simply your blueprint. For those of you who used to like looking at the syllabus of any course, the First Aid Series is simply the syllabus of these international exams, including both IFOM and USMLE, okay? The third thing is going to be your Boards and Beyond. Boards and Beyond is going to be the lectures as well as the slides that expand whatever's in Boards and Beyond. These, again, 3 of the essentials. The fourth is Pathoma, which is an integrated pathology review. It covers almost everything in pathology, and it actually does a little bit more than pathology, and we'll tell you more about each of these, okay? The fifth is Sketchy Medical. It's simply for, I don't like to say for visual learners, because even if you don't label yourself as a visual learner, you still have to give it a shot. It's simply, it's similar to Pixarize and others. It simply draws you certain scenes or like stories, and it tells you like some analogies for you to remember. Now they're expanding very into anatomy, physiology, biochemistry, etc. But those we recommend are essentially the pharmacology and the pathology part, as we'll tell you later on. Next is Anki. This is now the list of the 6 most important resources. Anki is a flashcard program. We're considering conducting a special session for you guys to get oriented around Anki, how to make the best out of it, and probably all the details you're thinking of about Anki are going to be addressed in a specific session. So once we send you feedback of this session, please make sure you don't miss out the Anki part, okay? So one might say these resources are too many, but it's important to highlight that you don't necessarily have to cover all of these resources. Like even in percentage, you don't have to cover all of them. Like for example, the entire Boards and Beyond or the entire Pathoma, for example. The more, the better. And it's important also to keep in mind that some of these are redundant. For example, the Pathoma explains pathology. Boards and Beyond does explain pathology as well. So it's usually going to be your decision. I watch Pathoma at that particular part. So for example, I watch, let's say, bone cancers from Pathoma, and then I do a quick review on Boards and Beyond bone cancers. I watch it at speed of 2, for example. There isn't really much differences. Okay, that's it. Then I'll study only Pathoma, and so on. Sketchy, you probably will use it only for specific lessons that you think are important. So if you're being troubled with the pharmacology of anti-diabetics, for example, you give Sketchy a try, but not necessarily watch the entire Sketchy pharmacology, okay? Next on the list are a few other resources. It's not that these resources are bad, it's just that you should not overwhelm yourself with resources. Do not do more than 6 resources. This is going to be a lot, you'll overwhelm yourself, okay? Some of these are resources that we recommend during the semester. Others are just alternatives to other resources. You can see AMBUS, for example, is a comparable alternative to UWorld. And we can address some of these references again or resources in the next session once we send you the feedback, okay? So after knowing these broad lines of resources, the next thing is to understand what is your study material. So the exam content is divided once in terms of studying into the high-yield general principles and the high-yield organ systems. General principles include the general biochemistry, immunology, microbiology, pathology, pharmacology, and the public health sciences, which includes the biostatistics as well as behavioral sciences. These parts are essentially covered in, technically should be covered before the organ systems in college, which is about technically year 1, but it's quite difficult to do so. So these are usually embedded within our units. Next is going to be the high organ systems. These are simply the units you study in college, bearing in mind that some of these are not going to be covered before, for example, your first attempt. You will still have neurology ahead of you, but you can still pass the exam with whatever of the other systems that you've studied, okay? Now we'll take you on a quick tour that is very, very, very important. It is our take-home messages of most of the study material that is divided by general principles, okay? So for example, when you talk about the general pathology, it's a very important principle or a very important, let's say, chapter. And we recommend specifically for this to make sure before you go to your IFOM, whatever attempt you make sure you cover the very first 3 chapters of Pathoma. It's not that these are the only parts, but these are very, very essential. As we shall see later on, once you're studying, for example, using your Pathoma and your iPad, you're watching the videos and you're making your notes, it's going to be much more convenient to have Boards and Beyond slides on your iPad as well. Once you study a particular topic, you can see whatever of this topic is corresponding on Boards and Beyond. For example, I studied, let's say, apoptosis in the first chapter of Pathoma. There is another video in Boards and Beyond that is entitled Apoptosis. It's actually wise to watch both videos. One of them should be at a higher pace, so you watch it faster because you're just trying to kind of have a quick revision and make sure there aren't gaps that either of resources are going to fill. And once you finish these, you would know, for example, now I have transferred all the notes into my Pathoma slides or Pathoma book. I don't have to study something else other than Pathoma for the future. Or wherever you're revising. We've added immunology next to general pathology because these are somewhat intimately linked, particularly if you're using Pathoma. The good thing, again, as we shall see about Pathoma, is that it covers beyond pathology. So some of the immunology parts are going to be covered in these 3 chapters. But as far as the exam is concerned, pure immunology questions are less likely to come. But for example, there will be some sort of a biochemistry embedded within the immunology questions. And it's not going to be a straightforward immunology question. We've attached here a sample picture of one of our members' page notes. So this is kind of the, let's say, the ideal situation we're kind of trying to promote. It's that someone is watching the Pathoma videos. You have to avoid the passive learning part of it. You should not be listening to the videos without making your notes right away. These could be as simple as highlighting with a specific color code. Make sure you highlight whatever, for example, Sattar, which is the guy who explains Pathoma, whatever he says is important, make sure you make it very clear to yourself that this is important. You can use your own color coding for the treatment, for the complications, for the signs and symptoms, etc. As you can see on the right margin, these are some bits that are added from different resources. You might as well recognize that this is a screenshot from first aid. There are some red arrows. These red arrows are actually highlighting some parts that are only in first aid and are not on Pathoma. So these are the ones you want to focus on once you're revising your notes. You can see as well, this is actually Pathoma from the first chapter, but you can see this is a screenshot again from first aid, and it actually has a part of immunology. So this is an example where an immunology question may be embedded within the pathology. And we'll leave you later on to read through these chapters. Okay. So this is actually an example of a question that is very important for your IFOM. We had somewhat similar or identical questions, and it's up to you to focus. So I guess you can all read the question. It's simply asking about what type of necrosis is shown in the picture. We're not really looking for answers, but you can type them, okay? I mean, we don't intend for this to put the question itself, but to highlight to you that the answers could be very simply stated in those resources that we've mentioned. You can see this is a screenshot of first aid. It's simply a table that summarizes all types of necrosis, and it clearly states that in coagulative necrosis, the architecture of the cell is going to be preserved. And in Pathoma, there's actually a screenshot. This is of the pictures in Pathoma that is almost identical to that's present in the question. And these are simply as almost equivalent to the IFOM questions. And this is an immunology question. It might seem quite too long, so I leave it for you later on to read. But simply the question is asking about the diagnosis and the best long-term treatment. If we cut this question down into the shortest of it, it's about a baby who has a susceptibility to all types of infection, fungal, bacterial, viral, etc. And the baby has low T and B cell lymphocytes. So the question is asking, what is the deficiency? This is actually a question that's targeting both biochemistry and immunology. And it simply speaks about SCID, which we had specific week through. So we had specific week in the college. And the answer is simply adenosine deaminase deficiency. And this is a screenshot from Pathoma. You can see that the long-term therapy is going to be stem cell transplant. So this is a sample of how an IFOM question could be. And this is how easy you can answer these questions or prepare for them. Next is microbiology. Microbiology may be quite heavy to memorize. This probably the play where studying smart is better than studying hard. So probably the questions would be focusing on you trying to identify the causative organism or the characteristic lab tests for certain organisms. For this, probably the best technique is actually to look for buzzwords. So this is, again, another sample of a question that was in the IFOM exam. There is one thing you have to know, that Aspergillus is a fungus that likes to attack a lung wherever there is a pre-formed cavity. So simply a question that would be this long, it will just have embedded in it says, oh, there is a pre-formed cavity. With whatever, they can rephrase it in any means. But once you know it's pre-formed cavity, there is at least a 95% chance it's just Aspergillus. Solve the question blindfolded and move on to the next question. Okay. If there is a single thing you want to memorize about microbiology, it's going to be something like this. This is a screenshot from first aid. Again, you can see that this is actually a graph that tells you almost about the most important gram-positive bacteria. And you can see how you can clear out your mind about these, for example, being, let's say, catalase positive, so you go this way, catalase negative, you go this way. For people, I'm not sure if it's, again, important or not, but for MSK exam, we had a question that says, for example, a bacteria was catalase positive, coagulase negative, and it was not taught in the semester. But the lucky ones who had just skimmed through this graph before the exam, they could just answer that was Staphylococcus epidermidis. If there is two things you're going to remember, then of course there is always gram positive and there's gram negative. So this is the gram negative version of the story. This is now a sample question. Again, I'll leave it to you for you later to read through. You can see the question is asking about the most likely causative organism. If we cut it down to the shortest pieces of it, it's actually going to show you the clues, including, for example, young-aged adults, diffuse petechial rash, hypertension, and fever. Might show you a picture similar to this. The causative organ is going to be Neisseria meningococci, so meningococcal infection. You can see here the bits highlighted over here are specifically as almost identical to those in the question stem, okay? So this is how you should be studying. So next is pharmacology. For pharmacology, we need you to focus on the mechanism of actions and the side effects as the most important things. However, the basic pharmacology that we've studied, pharmacodynamics, pharmacokinetics, I know probably all of you hate Michaelis-Menten things, specifically for Michaelis-Menten, the first, second order, etc. These have few boards and beyond videos that hopefully make it simple. And again, it's your decision. Some of these are not as high yield, but if you're aiming for 80 plus and so on, then few actually hours for these won't actually harm you. It's, I think, very important to highlight that other than the basic pharmacology, you need to be aware of the treatment of certain infections at least. So for example, antiretrovirals is a whole set of videos that you can watch and material you can study. The treatment of TB is very important as it is. There is a specific treatment for TB. The therapy for hepatitis, the difference between hepatitis B and C, which one of these is treated. STDs, we had IFOM questions about the treatment of STDs. We have studied this with Dr. Saghir. You'll probably find the lectures. And then chemotherapy, and probably also add H. pylori. You have to know the triple and quadruple therapy for H. pylori. Okay. For pharmacology, the last bit of it, other than Sketchy, as we shall see later, is the summary aids. So you can find always summaries in first aid for specific topics, and you can always make your own summaries. Make sure you have those topics troubling you. If you make a particular summary, you hang it in your room, for example, on your desk, for example. If you look through it every other day, for example, the pieces of information are going to stick in your head, and you should be fine with these. Sometimes you might collaborate with your friends. You can make kind of you make a summary of a certain topic, and your friends do a summary of a different topic, and then you can share these together. This is a question about pharmacology. You will study this later on, probably in multi-system, I think. But this is a very, very classical question. Again, this was in the IFOM exam, probably very similar question. Simply, a patient takes an inhaled anesthetic and develops signs and symptoms of a condition known as malignant hyperthermia. The question might very clearly ask you about the mechanism over here, which is the mutations in ryanodine receptor. And it might clearly ask you about the treatment. So here it was, what drug should you give, which is dantrolene. Next is biostatistics, a topic probably you've all enjoyed with Dr. Suhail. The good thing is that Dr. Suhail really prepares you almost higher than the standard you expect in your exams. So there are about 60 questions in UWorld. If you probably to go for biostatistics. The very specific part you have to know by heart are the very basic calculations, the positive predicting value, sensitivity, specificity, and these. And of course, the normal distribution or the Gaussian distribution. Very classical question. It tells you, for example, it will give you the standard deviation, and it would ask you how many people are above a certain value. For example, value is actually 2 standard deviations. Probably you've seen similar questions, and you can always text us for help. Next is a similar a sample question for biostatistics. This could come in your IFOM. So the question is quite lengthy, but you already solved the question if you manage to create such a table. So this table may not be in your exam. So you'll have to imagine the table or write it down. Once you have it formulated, you can easily remember your formulas, and then you can calculate your answer. This is probably not the answer. I'm not sure. It's just the sample for the equation, okay? Next is the behavioral sciences part. The behavioral sciences is actually, usually it's a small proportion of the exam, but it may still come. So personally, we don't recommend you studying this first. So probably set it somewhere in the end if you have done it. But make sure you don't memorize the DSM-5 criteria. Don't go very detailed. Look for the very specific things, in particularly first aid. It's very, very helpful. So if it tells you a child who does X and Y is probably this one. If first aid says that X is characteristic, then choose that answer and just move away, okay? Next is biochemistry and medical genetics. This is probably the heaviest part to study and to memorize. We don't really recommend memorizing these. Like, for example, you open your first aid and you start memorizing all these pathways, all these enzyme deficiencies, etc. A more interesting, user-friendly approach is actually to study these through the organ systems. For example, you've been through, for example, let's say even in MSK, for example, the musculoskeletal system, you may have studied gout. In body defense, you may have studied the purine metabolism. In either of these, actually 2 different lectures in 2 different units, you've been exposed to the purine pathway metabolism. Over there are actually 2 characteristic enzyme deficiencies that may lead to SCID, as we've seen earlier, or may lead to Lesch-Nahan syndrome. So both of these are 2 conditions that are purely biochemistry, but you can study throughout other systems. Once you're studying these, we don't recommend putting these as the first part. Nonetheless, at least a personal experience in the IFOM attempt we had, there was actually some kind of medical genetics questions. So make sure you're familiar with the basics of autosomal recessive and autosomal dominant. There are a few annoying equations that you have to know from the first aid book. Make sure you go through these, as well as the lab techniques. So there are some topics that you may come across in UWorld. So if you're solving a UWorld question and you come up across a topic that you hate to study, the very least you can do is study the question justification. So make sure you read through it. If there is a particular summary over there, make sure you give it a try. I've listed some examples over here, including methionine cycle, lactose intolerance. These are few cycles or certain equations that you have to know, like pathways. Other topics include the vitamins. You need to be very, very clear about the vitamins. a certain vitamin deficiency. What is a characteristic of a deficiency of particular vitamin? These you really need to know by heart. The different types of collagen, which collagen is affected in particular disease. Once the wound is healed, which type of collagen is placed first, which one is placed later, which type of collagen is in the bone, which is in the cartilage, and so on. Next is the chromosomal anomalies, the trisomies. You have to know by heart. You have to know Edwards syndrome. You have to know Pathoma syndrome, and you have to know Down syndrome. And then there are a few others. Turner syndrome is very, very important. A webbed neck, a wide nipples. This is a very characteristic question. You'll find it in most of your exams. So make sure you go through these specific topics of these general principles. We provided you some samples over here. These are actually screenshots of UWorld material, which is not supposed to be screenshot. But as you can see, this is in this cycle a lot of questions. I've solved a question that I had almost nothing except a single clue about the question that I've came to know by chance before the exam, and it was enough to solve the question. So in some patients with Marfan syndrome, they have accumulation of homocysteine, as you can see over here. The question in IFOM was like, what supplement to give these patients? It was simply vitamin B12 because you kind of try to reduce the accumulation of homocysteine. You give B6, you try to shunt it through this pathway. So this is an example of a pathway that you have to know. Again, not in all the details, but you have to know the general idea of it, okay? This is another sample. You probably all know lactose intolerance, which is the pathway between lactose to galactose. This is the place where lactase works. Lactase deficiency or intolerance is very, very important. It will be with you in IFOM 1 and all throughout your clerkship phase. So make sure you know it. Once you solve a question, you see this graph, you probably should familiarize yourself with the enzymes A, B, C, and D as well, because what this graph tells you is simply there are actually, for example, you can see here 3, 4, 5 possible questions. So don't miss these 5 questions and just solve a single question. This is an example of a question that you can read later on. Again, if you haven't studied the specific material, don't panic about these questions. Once you study these, it's a very simple question. It simply tries to contrast B12 deficiency against folate deficiency. And again, all of these bits of details are present in your first 8 summaries, as well as in boards and beyond, okay? We can provide you with the answers with all the details if you wish later on. Okay. If there is a single resource that you will be using and no other resource, though we don't recommend this approach, but if you have to do this for whatever reason, the single resource has to be UWorld. This is the most important resource, and we need you to think of it not as an assessment tool, but as a learning tool. I don't tell you to go solve questions blindly all the way and keep getting all the questions wrong. There is nothing in solving a question wrong, but again, it's important to stimulate your mind into trying to kind of recall as much pieces of information from your memory. But again, if you haven't seen a question anytime before, just give it a try. And then if you solve it wrong, make sure you read whatever comes as justifications and then move on to the next question. You have learned that particular lesson. As I say, it's okay to start with a question block, not knowing all about it. So for example, I've started studying MSK this week. It's only been 2 days since I've started studying MSK. It's okay to solve questions about MSK and general pathology, for example, because I finished general pathology last week, let's say. So I'll solve with general pathology and MSK. I know that I'm still covering MSK, so if I get questions wrong, I should not be as disappointed. We don't recommend binge solving questions. You won't be as efficient. You won't recall as much of the details. Again, it's a studying tool, so don't just rush through it. Make sure you flag the difficult questions that you go through in UWorld, and make sure, of course, to remember your username, because we need you to flag the questions that you think are important, those that you think are difficult, those you think that have a good summary in their justifications. And anytime before your exam, you can specifically go back to these flagged questions. And personally, I found it helpful because we might now be planning, for example, for USEMILE, let's say step 1, we may not be able to solve all the 3,600 questions, but probably it's worthwhile to go back at the flagged questions. So we may have solved 1,000 questions in the past. We have deemed, for example, 200 of these flagged questions. So it's much of a help now to go through 200 out of 1,000, for example. Okay. And if you ever get questions wrong, make sure you know why these are wrong, and you can specifically create an exam in UWorld that is made up only of the wrong answers, which is something you, if you have a spare time, we recommend doing. Again, make sure also to have the questions randomly listed. For example, don't always expect the question to be at a particular topic. Try to mix them. Once you cover up a new system, add it to your shuffle of the questions. So these are the major points about UWorld. We'll give you some details about first aid. Again, we said that this is your blueprint, and because simply boards and beyond in particular is simply an extended version of the first aid. So make sure you have these along each other. So we really recommend you having the PDF version of this book so that you can cross-check between it and your boards and beyond slides. It's about studying things actively. Don't think of this as an additional burden. It's actually very important for your retaining of memory and also for you to change your routine. If you keep studying in a certain particular way, you will probably get bored. But if you keep changing these different styles and techniques of studying, you will manage to go through a much longer period of high productivity. Again, as you've seen, USMLE First Aid has a lot of summaries. We recommend you taking screenshots of whatever you think are good summaries and put them, for example, in your Pathoma notes, so that whenever you have to revise a particular topic, you just quickly go through one of these resources and don't have to go through each of these back and forth. And some of the summaries can last, and you will be actually going back through these summaries in the future. Personally speaking, in year 4, in the clinics, whenever I am bombarded with a very sudden, unexpected question that I have no clue about, I simply open my notes application and I just write whatever highlight or specific word. And oftentimes I find myself in summaries that I've written before or on a specific page of first aid. So that's why we recommend you having the PDF version of the book. Okay. And it's very important to highlight out of experience that every word is in this book is important. The book being annually released means that it's annually kind of updated based on student feedbacks in particular. So we had an IFOM question once we hadn't already studied neurology yet. There was a question about a drug in anti-epileptics, which is a neurology part. We had no clue. We had to guess the question. And then once we came back to first aid and we opened the book, the summary table specifically lists this particular drug, and between brackets, it says monitor for hepatotoxicity or measure liver function tests. This was simply the question, what to monitor the patient for. So again, the words in this book are all important. We recommend, so once you've been studying your boards and beyond, you're trying to cross-check with Pathoma and first aid. You have been highlighting through the book in your PDF version. We really recommend that once you finish a particular chapter, so I finished reproductive system. Now, once I finished all the resources I wish to study from, we really recommend you going through your first aid as like a skimming. So you read through it. You will be first revising all the material you've studied and noted. And the second thing is you will find whatever paragraph that is not highlighted yet. This means that this is a gap that was not covered by any of the resources you've managed to study. So this is really helpful, and it's like for you, it's the part where you make sure you've studied the system properly. Okay. The very end of the book has a rapid review tables. These are quite good for sort of your very rapid review. So it's a table that tells you the very characteristic clues of certain things. So it tells you, for example, a newborn with cataract, sensory neural hearing loss, for example, etc. What's the answer? It just lists you the answer. These are the characteristic clues for this particular answer. So whenever you're bored or something, you can use this, or whatever in public transport or something. It's very helpful. And again, in the end of this book, it tells you some of the question banks and resources. It lists them in the end. So if you're looking for additional resources, references, you could go through the end of the book. This is a sample, a screenshot from a table. It's kind of a graph that some of you might recognize, not in this exact format. This is simply the graph that's taken from first aid, and annotated on it are hints, are kind of pieces of information that are taken from at least 3 different resources, including IFOM 2 related. So this is just a sample for you. Once you're studying, once next time you come back to revise your asset-based balance, let's say, for example, once you're in the hospital, you're in the ICU and a doctor asks you a question, you'll find these summaries very helpful to go back to, as well as in the exam. They will help you orient your thought process. So for example, if you identify a patient having acidemia and then a metabolic acidosis, you know that the next thing is to calculate the anion gap, and you'll be orienting yourself throughout this pathway for the answer. The next is Pathoma. This is one of the most important resources. It is not as heavy as others, so we strongly recommend you going through the most of it as much as you can. The thing is that Pathoma does not only cover pathology, strictly speaking. It actually tells you, for example, once it talks about a particular disease, if there is a relevant anatomy, it would revise it. If there is a relevant physiology, it would revise it. And if there is a relatively important therapy, it's going to list it as well. So it gives you this added benefit with very, very brilliant explanations and sometimes summaries. I have memorized the coagulation cascade through Pathoma, and it's probably something yet, if you haven't tried, once you try, give it a chance, you might really like it as a memory tool. I've seen reviews from people in the US who've been through the Yosemite. Once Dr. Sattar, who explains these videos, says that this is important or this is relatively high, it's recommended to take his word and expect this question whether an IFOM or Yosemite. The pictures that are listed in the book are listed there for a purpose, so make sure not to miss these out, whether in your studying or once you are in your revision. This is a screenshot of Dr. Sattar explaining the coagulation cascade. Because I've revised this chapter over and over from Boards and Beyond and from Pathoma and other references, over time I kind of taken this some sort to a next level into a more compact summary that has even more details. You might not relate to these at the first look, but if you study, for example, Boards and Beyond now and Pathoma, you would know, for example, that every letter T over here is color-coded with thrombin because thrombin simply activates all of these factors as well. And so on. Whatever is in purple is called intrinsic case, or the intrinsic kind of the bundle of the factors combined together, and so on. So this is really how we recommend you studying, not passively, but also to study these and try to kind of synthesize some of the details, because once you make such a summary, you'll always go back to this one and you'll never kind of forget the details. This is a screenshot again from the notes of Pathoma. This is part of the MSK. You can see that there are actually screenshots of first aid on the top left over here. Because these notes were put during the semester of MSK, there was somewhat more time compared to now once you're preparing for the exam. So there are osmosis screenshots put over here. And there are also here some detail. You can see, for example, here a screenshot from Boards and Beyond. So as each of you personalizes their own style of studying, you can always share similar notes like these in editable formats, and every one of you can customize their own type of notes. But again, the broader lines of these should be the same, and you should all help each other. One of the few remaining ones is Boards and Beyond. For Boards and Beyond, make sure to have it as your interactive checklist. It gives you a progress bar of all the resources that you're studying. There are questions after each of the chapters on Boards and Beyond, so make sure you solve questions after a whole chapter. Don't watch a video, solve question, video question, video questions. Rather, watch all the videos of a particular chapter and then solve the questions. And make sure you cross-check the material in Boards and Beyond with the other references, as we've been saying, particularly with first aid. Okay. This is here a sample of how your notes may look like. Personally, I have a file that's called Self-Directed Learning that has the Boards and Beyond file. In Boards and Beyond, I have general principles and organ system set alone, and the file that includes all the notes. Whenever I click the search feature, I could find myself in any of these files. And of course, you can have also your relevant books, First Aid and Pathoma and others. Okay, as we approach the end, this is a screenshot of Boards and Beyond. You can see on the bottom, on the mid-right side is actually the progress bar of Boards and Beyond. I've personally entered my first IFOM attempt with less than about 50% progress. and I managed to do just fine. So again, this highlights that you don't have to do all the material. For Sketchy, we'll move fast through it. I only recommend Sketchy for specific topics. Don't watch all the videos. It will take a lot of your time and your memory. So watch the topics that are troublesome. I strongly recommend these specific topics, but it's not an exhaustive list. Specifically, the HHV family of viruses. There were details that solved IFOM questions, so these are very important. The questions provided in Sketchy are not as important compared to others. I provided you a sample of how my Sketchy notes look like. You can do this as a collaborative work with your colleagues, such that in the future, once you're revising these, they don't take as long of time. But again, this is one way of doing it. You can always make your own way through it. We end first part of the resources. We're trying to conduct a different session for Anki, UWorld, and Ambus. For boards and beyond and first aid, I've covered much of what you need to know about these. We leave you with the rest of resources, such as some of you listed physio as part of the resources in the feedback. There's a website called Reddit. If you're looking for a review for any of these, make sure you Google the name of the resource and then write Reddit after it. So, for example, boards and beyond review Reddit, and then you read the review of other medical students across the globe. Okay, we move to probably the most important part. Just to make a quick note that we're all medical students. We're not as financially independent, but it's recommended that if you can pay for a particular resource, find some discount codes or group memberships. It really helps you, and probably you'll really benefit having such interactive interfaces rather than screenshots and so on. So now is the key to your acing of the exam. You know how the exam is structured and you know where to study from, but then actually where to start and how to start and for how long we'll be studying. So once you're preparing for the exam, we realize that the exam covers a lot of material, but we need you not to panic. You don't have to cover the entirety of the material. You can still score even 90 plus without covering the entire material. And as a side note, solving exams is going to be a second nature for you. You'll be setting a lot of exams through your medical school and once you become a doctor. So really try to embrace yourself through these experiences. Getting above 90, above 80, above 85 is not impossible. It's a little bit challenging at certain times, but again, keep your eyes on the target, and then these little steps are going to get you along. If it doesn't get easier, God forbid, you will eventually get stronger. So again, we need you to keep your breath through the process, okay? I'd like to extend a special congratulations to those who've been going through extra miles once they're studying their notes in CMed, whatever you studied from, for example, Robbins or other references. What you're seeing now are only actually summaries or the high-yield material of all that you studied, so your job would be much easier. So how do we study? Again, we need to highlight that studying plans are very personal. There are certain tactics that are effective, but we'll give you the best thing that we can help you with. And it's up to you to choose whatever to cover and whatever to skip. It's important to keep in your mind that it is almost impossible to cover 100% of the material. So you need to be wise about what to skip and what to cover. Sometimes it's better to skip a particular topic than to study it because you'll save much more time for other topics. Again, all what we presented is the ideal scenario. All of what we presented is you towards 100% of the exam. You may strike anywhere else, even 100% without covering much of what has been said today, okay? But this is our experience. So again, there's no one right plan. The general scheduling advices include 2 to 3 months. If you have even 2 months, you can still do it and get a very high grade in your IFOM, okay? This is the first take-home message. We suggest, but we don't necessitate you starting with MSK and reproductive system for those students who are currently just finished these systems. Because you've just studied these, once you study these now, you'll progress through these faster. And once you'll be doing your UWorld questions, for example, you can have these part of your exams. Again, we cannot emphasize enough the first three chapters of Pathoma. Try to solve questions as you go along. And again, as we said, once you study a particular system, you add it into your schedule. Bear in mind that you will be studying for, let's say, 2 to 3 months. So make sure you solve enough questions about the systems that you're covering towards the end of your study period. Probably the classic version of making study schedules is trying to do manually. I hated this type of schedules because they are not as updated and you usually mess these along. We provided you a sample where you study these references and then you take your Friday as a family day and then you do some little Anki to maintain your streak and so on. But this, as I can see, is the old version. We will be recommending you a resource that provides you with all these benefits. So imagine having a resource. Yeah, it's that one card that keeps your streak. So imagine having a resource for which you can that could create you a schedule that you decide, I want to study Pathoma, Boards and Beyond, Sketchy, etc. So you decide specifically what you want to study. You set your own pace. I want to watch the videos at 1.25, for example. I want to do X number of flashcards every day, X number of questions every day, or I want to solve, for example, by the end of my study period, I want to solve this particular number of questions. I have X number of hours in my day. I need a break day every other day. I need a catch-up day at a particular time, my exam date, and all of these bits of details. If there is one particular program that could do all of this, it's going to be a magic. And we're more than happy to tell you that magic actually exists. And there is simply a program that could give you all these benefits. And it's really, really cheap compared to other resources. And the very powerful thing in this is that sometimes you are not as progressive and sometimes you mess up your schedule. Whenever this happens, it was very difficult to edit your manual schedules. But now with a single click, you can reschedule all of your overdue tasks into the remaining period of your studies. And this is the resource that helped personal experience. This is the resource that helped me the most. It's called Cram Fighter. This is a website. It used to have an application, but at the moment it was sold to a different company. So it's kind of being revamped into a newer version. I used the older version, but unfortunately not there anymore. The newer one is there now and you can use it. We'll send you later on a discount. There is a promotion, so you get some percent of discount. It's called Step 22. We'll write it in the chat. We're not being paid and we're not taking any benefit out of this. But again, it's just that it's our personal experience that we thought we could share. This brings us to a conclusion of few words that we wish to tell you very sincerely. For those in batch 2025, as well as other colleagues, particularly those because of your study period, it might be a little bit stressful, but make sure to keep in mind that sleep very well. Again, I say that sleeping is like your button, so you have to make sure you get your minimum sleep every day. I personally recommend waking up as early as possible. If you wake up by Fajr time and then you start studying 2 or 3 hours, let's say maximum 2 hours after Fajr, by the time it's 11 or 12, you have almost finished your study material and you can decide what to do with the rest of the day. As a friendly note, I recommend you to capture your moments. Sometimes you might find yourself in college, sometimes in coffee shops with your colleagues, sometimes in QNL and other places. Make sure to take pictures of yourself, your colleagues, videos, all those moments for your future. Make sure to save these. We recommend studying into different places, different styles, and different settings. So don't keep studying in the same place all the time. Don't binge watch a particular resource. So make sure you change the styles and the places and everything. So sometimes you wish to revise only. So probably you take a walk with your iPad and so on. Make sure to take adequate breaks. If your mother asks you to do something, you can do it and you won't actually fail. So don't find excuses not to take any break, including hangouts with your colleagues from other colleges as well. It's very, very important not to compare yourself to others. Everyone's story is different. If your colleague has finished 3 systems today and you finished only 1 system, it doesn't mean they will get a higher grade than you. It doesn't mean that you're doing bad. It doesn't mean they're doing better. So make sure you don't compare yourself to others. For exams, make sure to smart guess the questions. And towards the end, make sure to help each other. It's very, very important. Please, if you're taking a simple lesson from us as your colleagues, it's to help each other. We don't mind sharing with you the references that we've learned over very long periods of time and very long nights and very bad experiences. Make sure to share it with your colleagues. If you manage to make a particular summary, share it with your colleagues. They will share their summaries with you. But again, it's not a matter of comparison. Rather, it's a matter of help. Okay, that's for you, 2025. For our friends with the college, with the batch of 2026, you still have a semester ahead of you at least, or a year. So probably now you know the tricks. You know that first aid is important. Boards and beyond is equally important. So you can study these throughout the semester. UWorld questions, if you manage to get your hands on a subscription, make sure to try to train yourself on it. Try to solve as much questions as you can as you go along the semester. For the organ systems, we really recommend you going through the books during the semester. Do not skip Robbins, do not skip Guyton, do not skip those references. These are the references. Again, the exams are simply summaries of these references. Once you study a broader topic, Najib is during the semester is something that's very, very important. Again, the moral of the story is that if you study this much of material and you remember only 20% of it, your 20% will be a lot. But if in the beginning you've studied this much and you remember 20%, then your 20% may not be sufficient. So please keep this concept in mind. So again, the last part of the message is try to do the general principles. As I said, these are essentially covered at the basics as year 1 and pre-med, but we don't have these as equivalently in our college. So if you can cover these basics at some point earlier than your study period, you'll do yourself a favor. Anki, we can cover it in a different session based on your wish, and we recommend you starting as early as possible. This brings us to an end where we need to thank the colleagues who started a similar gesture. Our graduate doctors, Umar, Ali, Khalid, and Rida. These guys gave us a lecture 2 years ago that we've been inspired with that lecture to give you this, with that session to give you this session. So special thanks to these guys. And probably you can take a screenshot. I hope you can see all the numbers and details. These are the numbers of some of the members who are currently more than happy to answer your questions or help you. Feel free to reach for us through WhatsApp, through email, for any help. I really conclude with this hadith, and I would say the last message in Arabic, particularly this part, Hadith Rasul Sallallahu Alaihi Wasallam. I like the part where it says, "Ihris ala ma yanfa'uk wasta'in billahi wa la ta'jaz." My father tells me the first rule of war is not to shoot yourself. If you shoot yourself, then so if you tell yourself, I cannot do it, I'm bad, I haven't been studying since year 1, blah, 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 all these are excuses to keep yourself in your comfort zone. If you start, you will end up where you want, inshallah. Thank you, and hopefully we've been answering your questions in the document, and we're kind of sorry that the session took long, but again, based on your feedback, we try to make it as exhaustive as possible. Make sure to keep the highlights set in mind, and if there is any burning question, please feel free to open your mics or write in the chat at the moment.
Just a friendly reminder that there's a link that I'll be pasting right now in the chat. Here we answered almost all of your questions, if you don't have any at the moment. I don't know who this guy AB is, but similar question was asked previously, and you can find the answer. However, just to answer you verbally over here, yes, it's almost similar for every exam, but you can check the rubric every time on the website before you commence your exam. I don't know who you are, but you are an AB.
Sorry, Yazan, but just for Lena, before he, probably Lena is a she, so before you leave, because it's just a message to everyone, we strongly don't recommend any of you to miss the first attempt. Please pass this message to your colleagues. The college attempts are fixed. You cannot change them, but you can skip them to your own wish. But we strongly recommend you not to miss any of these. Even if you think you're not prepared, even if you think you have so much more to cover, do the attempts. Oftentimes, the questions may be repeated between attempts. So if you see a question a particular time, you might go after the exam and study that question or topic. You see your report, you see where the gaps are, you fix these gaps, and the next attempt, it might be exactly the same exam. There are always these chances, or at least questions are repeated, so make sure you don't miss any attempt.
By the way, this session was recorded. We shall share the recording soon, so stay tuned. There isn't. Okay, that was a private question. I'll answer you in private then. All right, I guess that we can call it a day. That's a wrap. Thank you everyone for being here, and we really appreciate your presence, and inshallah we'll share the link again, as I mentioned, to your representatives, and they can share it to you. Have a good day.